morning, good afternoon. I'm Nafisa Diop, the Chief of the Gender and Human Rights Department at the United Nations Population Fund, UNFPA. On behalf of the UNFPA Executive Director, Dr. Natalia Kanem, it is my profound pleasure to welcome you to the first of a series of global conversations. Last year, the world marked the 25th anniversary of the landmark International Conference on Population and Development, ICPD. Through this global conversation that we are starting today, we are forward-looking from the Nairobi summit, looking at the next 10 years that are leading us to the 2030 benchmark. And it is no coincidence that we are commencing this series, the global conversation on gender-based violence issue, because COVID happened. And we started our decade of action with a new threat and this pandemic. And we all know that when peace is disrupted and conflict emerge, women and children are the most affected and vulnerable to the consequences. So without further ado, allow me to introduce our esteemed guest who will guide us through today's conversation. The UN Secretary General and UNFPA Executive Director, Dr. Kanem, will be joined by a high-level panel of top leaders, subject matters experts, advocates, activists, and young persons from government, community, and civil society. I have the pleasure to have today in this panel the Honorable Karina Gould, Minister, International Development, Canada. Bonjour, Madame. We also have today Honorable Manti Tarawali, Minister, Gender and Children's Affairs, Sierra Leone. Good morning, Madame. We have with us the Undersecretary General, Pramil Lapoten, Secretary General Special Representative on Sexual Violence in Conflict. Bonjour, Madame. We also have Mrs. Krishanti Dharmara, Executive Director, Center for Women's Global Leadership, Rutgers University. Good morning, Krishanti. And Dr. Hela Wenish, Manager, Center of Psychological Assistance of Women Victims of Violence, Tunisia. Bonjour, Hela. We also have our young representative and a man among all this panel of fantastic women. Mr. Jean-Philippe Lawson, youth advocate from Ghana. Hi, Jean-Philippe. And last but not least, we have Mrs. Akola Thompson, writer and GBV activist from Guyana. Thank you so much for joining. And through this global conversation, we want to call you to lending your voice to end all forms of injustice against women and girls on all your social media platforms using hashtag what is next for women. I repeat, hashtag what is next for number 4 women. Thank you so much for joining, and let's look at a video on Nairobi just to remind us what happened there and our commitment.
The program of action recognizes that healthy families are created by choice, not by chance.
that journey that began 25 years ago is far from over. It's now time to finish that unfinished business.
The Sustainable Development Goals cannot and will not be achieved until women, girls, and young people are able to control their bodies and their lives, free from fear and from violence.
We keep moving forward. We will not retreat. We will never give up. We are in a race to the finish line, and we shall prevail. Thank you. Nashukuru sana.
We all got a lot of energy from the Nairobi summit, and we are still keeping up strongly with that energy. Without any ado, UNFPA Executive Director and the Secretary General, Dr. Dalia Kanem, you have the floor.
Thank you. Thank you so much, Nafi, Excellencies, distinguished panelists and guests, colleagues, and friends. Greetings and welcome. I'm very excited. This is our very first Global Thought Leadership Conversation. Last year, on the road to Nairobi, as we commemorated ICPD25, we asked, what's changed? And we discovered just how much has changed in the 25 years since the International Conference on Population and Development in Cairo. Yet we know that it's still not enough, and this year, we're focusing on what's next. What do we need to do to accelerate progress for women and girls? And we're meeting at an extraordinary time, the COVID-19 pandemic, exposing stark inequalities and injustice in our world. We see a surge in gender-based violence, whether it's intimate partner, domestic violence, child, early forced marriage, female genital mutilation, sexual exploitation and abuse. And we see overburdened health systems that are struggling to respond amid the added demands now of the pandemic. For women and girls, it is a pandemic within a pandemic. And any discussion about how best to respond has to speak to the gender dimensions, to the pre-existing gender norms and inequalities. Gender-based violence doesn't begin with disasters like COVID-19. However, the chaos and the instability causes women and girls to be even more vulnerable. And I'm speaking not just in terms of health, but in social, political, and economic systems disadvantages as well. The so-called lockdown measures, they're leaving many women and girls trapped with their abuser and cut off from the essential services and systems of support just now when they need them the most. The health impact of intimate partner and domestic violence is significant, from serious physical injury to long-standing trauma and poor mental health, to sexual and reproductive health problems, including sexually transmitted infections, HIV, unplanned pregnancies. Research that UNFPA recently conducted with partners indicated that 31 million additional cases of gender-based violence can be expected for every 6 months of continuing so-called lockdown. And for health workers, the majority of whom are women, they may be at risk of violence in their homes or in the workplace. And the latter is a serious problem that can be exacerbated when health systems are under stress. So health managers, facility administrators, they need to have plans in place to address health worker safety. As UNFPA and with other arms of the UN, we are working with governments and partners to prioritize the needs of women and adolescent girls and to include essential gender-based violence services in COVID-19 preparedness and response plans, to resource them and to identify ways that we can make them much more accessible in the context of the social distancing measures. All protective services for women and girls must be classified as essential because they are. Educational prevention, domestic violence, hotlines, safe spaces, sexual and reproductive health services, referral pathways, police and justice mechanisms that involve men as allies. These are necessary before, during, and after any crisis. This pandemic is no different. We would like to ensure the availability of these essential services using a collaborative, coordinated, multi-sector response. And that is why UNFPA and our UN partners, and you'll hear from Pramila and others today, established the joint UN program on essential services for women and girls, and the RESPECT framework, which aims at prevention of violence against women and girls to begin with. For UNFPA, we've supported over 50 countries to provide integrated essential service delivery, building on existing standards across the health, social services, police, and justice sectors. And this work helps to strengthen the health sector. It helps to develop, for example, the capacity of a midwife, a nurse, or other health workers, social workers. So they support violence survivors and build strong interlinkages between prevention programs, health facilities, the police, and the justice system. And I'm glad that we have civil society voices on this What's Next global conversation today, because we face daunting challenges, but we should not be unnerved and we should not back away. In fact, we should leap ahead, looking for the opportunities where we can build back better, in the words of our Secretary General, and that goes for health systems too. Build back better so that our health systems are gender responsive and they're rights-based. As UNFPA, we feel this is an emergency and we want to take urgent action together with partners. And I'm so proud that Minister Karina Gould will be among the first to speak to this issue today. This is a global emergency. It demands our full commitment, our collaboration, and a mobilization, because women and girls can no longer wait. Thank you very much, Nafi, and I'll turn back to you.
Thank you very much, Dr. Kanem, for setting the tone for the conversation and leads well into the first segment. Before the first segment, I just want to welcome Honorable Manti Tarawali, Minister Gender and Children's Affairs from Sierra Leone. Good morning, Madam, or good afternoon for you in Sierra Leone, and thank you for joining us for this conversation. So the first segment that we wanted to address today is on the health system role in ensuring continuity of sexual and reproductive health services and gender-based violence as essential service in COVID-19 response. As Dr. Kanem has already said. Canada has been on the forefront in championing the maintenance of sexual and reproductive health and gender-based violence services as part of the COVID-19 response. So the Honorable Minister Karina Gould will address efforts being taken to strengthen the health system to respond to the pandemic. We also have in many countries, spanning from South America to North Africa, organizations who are finding innovative ways to provide supports to women and girls facing gender-based violence amidst the COVID-19 outbreak. And to bring in that perspective from partners working directly with women experiencing violence, we are also pleased to have Ms. Thompson from Guyana and Dr. Wenish from Tunisia. They will both frame their responses to actions being taken at community and national level to respond to gender-based violence within this COVID. Minister Gould, the floor is yours. Thank you.
Thank you, Nafi, and thank you, Dr. Kanem, for the opportunity to participate today. As we have watched COVID-19 spread around the world, leading to national lockdowns, quarantines, and orders to stay at home, women, adolescent girls, and children find themselves in confinement. For many of us, home is a safe space. However, for the most vulnerable among us, this reality has put them at an increased risk of abuse and led to what UN Secretary General Antonio Guterres calls a horrifying global surge in domestic violence. Actions to help developing countries respond to gender-based violence is part of Canada's feminist international assistance policy and our response to COVID-19, both at home and abroad. We recognize services addressing GBV, sexual and reproductive health and violence, exploitation, and abuse of children as essential and life-saving. Each is a critical element in health emergency, development, and humanitarian assistance, including global responses to the pandemic. While health systems are straining to respond to the current crisis, it is more important than ever to recognize underlying inequalities and discrimination. It is critical that we prioritize funding for sexual and reproductive health, gender-based violence, and recognize it as an essential part of the pandemic response, as something that cannot be reallocated. If we do not put the needs of women, girls, and children front and center in our response, we not only risk losing the important gains made in these areas in support of Agenda 2030, we risk losing even more lives. We must not let this crisis take away our chance to rebuild a more inclusive, secure, and resilient society. That is why I am pleased to take part in today's discussion and to tell you how Canada is taking concrete steps to ensure that COVID-19 preparedness and response plans include essential services addressing gender-based violence, sexual and reproductive health, and the abuse, violence, and exploitation of children. The costs of inaction are simply too high, and we know how to stop this trend in its tracks. In January, I had the opportunity to visit the Democratic Republic of Congo. One of the most impactful experiences of my life was sitting in the exam room of a clinic in Kinshasa, listening to survivors of SGBV tell their stories. They ranged in age from 4 years old to 34 years old. I cried with the survivors as they shared their trauma, and I swelled with admiration as they shared their healing journey. This UNFPA project underscored the already urgent needs facing survivors of SGBV. SGBV doesn't go away because we are confronted with COVID. The needs of survivors don't disappear because of COVID. In fact, it is now more important than ever as we see an escalation of SGBV around the world to double down on our commitments to fight SGBV, provide protection and supports for survivors. I saw firsthand how timely interventions can change lives and how the work we all do can prevent these horrors from happening in the first place. And we recognize that the implications for women in all their diversity are far-reaching. Women make up more than 75% of the healthcare workforce in many countries and perform 76% of all unpaid care work, including care of people who may have been exposed. This means that they are at greater risk of contracting COVID-19. Not only that, but because many of them work in the informal economy as farmers, vendors, and entrepreneurs, they are among the first to lose their incomes and livelihoods when countries declare lockdown. And they are often the last to be able to return to work as a result of school and childcare closures. At the same time, with over 1 billion learners out of school because of closures, girls are watching their chance of an education and realizing their potential slip away. Before COVID-19, gender-based violence was already a huge crisis. Now, with COVID-19, emerging data shows that mitigation measures like staying at home and social distancing have contributed to escalating violence against women and girls, especially intimate partner violence. We are also seeing an increase in harmful practices such as child, early, and forced marriage and female genital mutilation. In some developing countries, we have seen essential services such as those related to gender-based violence and sexual and reproductive health strained or even shuttered due to restrictions in movement, lack of staff, or funding. In this context, it becomes all the more important to protect the rights of women and girls and other vulnerable people. So how do we make sure that the needs of the most marginalized are met? By pooling our knowledge of what works and acting decisively. We must ensure that comprehensive sexual and reproductive health and rights are protected, and that health systems and the supply chains that support them meet the needs of women and adolescent girls. Governments and policymakers play a critical role in ensuring that services to address GBV and the abuse, violence, and exploitation of children are prioritized and included as essential services in the response to COVID-19. It is crucial that women and girls play an equal part in the decisions that are made in the COVID-19 pandemic response. Gender barriers to accessing health systems and essential services must be addressed to achieve the right to health and for us to achieve the SDGs by 2030. Only by investing in sexual and reproductive health and rights of everyone, especially populations in vulnerable situations, can we make healthcare truly universal. Right now, health systems are straining to respond to the pandemic, but the need to protect comprehensive sexual and reproductive health and rights, including access to safe abortions and contraception, is more important than ever. Canada recognizes the importance of integrating these factors into the way we strengthen health systems, including pandemic preparedness and response. We have shown leadership in responding quickly to the pandemic and will continue to do so on all levels. So far, we have committed $160 million in funding to support international efforts to respond to the COVID-19 pandemic, but fighting this crisis needs much more. Domestically, gender-based violence services have been declared as an essential service. Also, as part of its COVID-19 economic response plan, Canada is supporting women and children fleeing violence by providing up to $50 million to women's shelters and sexual assault centers to help their capacity to manage or prevent an outbreak in their facilities. In developing countries, our approach will help to build resilient health systems that include SRHR. Canada has an international reputation for putting women and girls at the center of our development efforts, and we will continue to do that. We recognize and support the work of grassroots women's organizations, which are on the front lines of the COVID-19 response. Their work is critical to the success of our efforts, and partners who work on SRHR have joined task forces on COVID responses. We are committed to ensuring that women's organizations in developing countries continue to have access to flexible funding and support through such initiatives as our Women's Voice and Leadership Program, because too often women's organizations are the first to have their funding cut in a crisis like this. Canada is also providing $2 million in emergency funding to UN Women's Trust Fund on violence against women to support the Trust Fund's response to COVID-19 for women and girls who have experienced gender-based violence in the COVID-19 context. And Canada has led the call to action on gender-based violence in emergencies and development of a joint statement on COVID-19 and gender-based violence. Our development activities to curb sexual and gender-based violence include adopting and implementing national legislation outlawing all forms of violence against women and girls, as well as children. We are supporting efforts to eliminate the cultural, legal, and judicial barriers that perpetuate impunity for violations of human rights of women and girls. In Honduras, for example, we are contributing to reducing impunity for crimes of sexual and gender-based violence by strengthening the justice system to reduce high rates of femicide and crimes against LGBTQ persons. We take a rights-based approach to prevention efforts, including access to health services, child protection services, psychological counseling, shelters, care facilities, and justice. For example, working with the UNDP, we are helping to provide services to survivors of SGBV through multi-sectoral service centers. This program contributes to a national campaign to change the perceptions and social behavior related to SGBV that engages men and boys. We continue our work to reduce harmful practices. For example, in partnership with Oxfam Canada, we are helping to reduce child early and forced marriage. This program has reached 245,000 women and girls in Bangladesh, India, Indonesia, Nepal, Pakistan, and the Philippines. People who are already living in a humanitarian crisis are even more affected by COVID-19 and the risk of gender-based violence. These are just a few of the ways that Canada is contributing to reinforcing health systems and addressing gender-based violence globally. And now I look forward to today's conversations, hearing your perspectives on these complex topics, and finding out how we can continue to work together to strengthen health systems so that they improve the lives of women, adolescent girls, and children, even during a pandemic. Thank you.
Thank you so much, Minister Good, and thank you for Canada commitment, and thank you for your personal passion and for sharing some of your feeling when you were visiting Kinshasa Center for Survivors. Thank you so much. Without any ado, Ms. Akola Thompson, you have the floor.
Thank you. I believe that COVID has offered many of us an opportunity to reflect on the socioeconomic issues that contributes to a lot of the crises that we have and face as women and girls. And when I think of the health sector particularly, it is very heteronormative. It's very centered on the patriarchy. And so when it comes to health system responses, LGBT persons are particularly discriminated against. Trans women in particularly face immense backlash, resulting in stigmatization, rejection to access to services, and often face violence from the very persons they seek help from. So I think in a lot of our responses, we need to ensure that they're intersectional and we do not leave out marginalized groups of women and gender minorities. When it comes to national and community leaders, we really need to stop a lot of the optical pandering we tend to do when it comes to women's anti-violence and liberation movement. There must be an active commitment to actively root out the classes and patriarchal beliefs that we have that currently drive our social health and economic systems. When it comes to bodily autonomy and self-care particularly, all women, regardless of their socioeconomic status, regardless of their geographical location, they must be able to have access to sexual health and reproductive information and services. We have long suffered from limited abortion clinics and policy restrictions that hinder women who are poor from accessing needed information and services. Here in Guyana, while abortion has been legal since the 1990s, we still have women who die regularly or who face sterilization regularly because they do not have access to the appropriate information and they do not have access to the appropriate services in their communities because a lot of it is very heavily centralized. And this is why we continue to see many unwanted pregnancies that continues to perpetuate intergenerational poverty and which tends to push women to seek out untrained persons for abortion services that often results in their sterilization and death. This is something that we need to continue to work and actively challenge to ensure that women have access to these services, ensure that they have access to information, because this will just continue. And many times I feel like we sit and philosophize and keep trying to reinvent the wheel when it comes to the solutions women and girls need for many of the issues we face. But generations of women have steadily stated the solutions that are needed. And while leaders often provide an ear to listen, they rarely ever act upon these recommendations, particularly when it comes to women and gender minorities. So investments, I believe, must be made in social programs that offer psychosocial support to women. There must be developmental opportunities for women and girls. We need to fund women's centers, invest in community building, invest in economic opportunities, and ensure that these monies are being appropriately spent. If you're worried about where this money is coming from, we have a lot of systems and programs that do not contribute anything positive to women's liberation movements. I'm thinking particularly about policing systems. We really need to start looking at ways of defunding policing systems. They have never been the friends of women's liberation movements, and they never will be, particularly for those who are poor. We need to invest and seek to fund and train social workers, counselors, and rehabilitation centers. These are the things that we need to focus on. And when it comes to women's economic insecurity, this is a very, very large contributor to gender-based violence, particularly now with many persons at home facing cutbacks and dismissals to their salaries. The rates of violence are steadily increasing. And I think that's something that needs to be considered. And well, we need to move past a consideration stage because this is something that has been touted for generations. We really need to look at how we start implementing paid women's caring work, because women are already burdened with unpaid caring work, particularly now these rates are just increasing and they're further burdened with unpaid caring work, which disproportionately falls on them and limits their ability to seek out other opportunities. This also makes them more susceptible to violence. And so when you think about the ways in which you aim to help and empower women, you really need to start putting the power in their hands. And a lot of times this power is economic based, because a lot of women are trapped in relationships where they're unable to leave because they do not have access to resources, they do not have access to education, they do not have access to developmental opportunities. These are things that we really need to start thinking about. Now, community leaders need to focus on increasing information and access to reproductive health care, social programs, and paid care work. Pressure needs to be put on national leaders because I know as a fact that a lot of them, particularly in the global south, are very keen to keep things just the way they are. And so we really need to stop reflecting and start making solid action plans and movements that will prioritize the care for women and ensure that the violence that is meted out against them is not further perpetuated and it does not lead to a further stagnation of our movement. Because I do feel that our movement for women's liberation currently right now is very stagnated. We keep moving in circles about what we should do or what should happen, and the action rarely follows through. So I think that's the way forward. Look at the action plans and start working on them. Thank you.
Thank you so much. Thank you, Mr. Thompson, for your insight and for representing also the situation in Guyana and in a lot of other countries where we are seeing, of course, the same pattern. And thank you for phrasing it so clearly. I would like now to call Dr. Wenish from Tunisia. Madame Wenish, please.
Hello. Hello.
Oui, bonjour.
Bonjour. Donc, in Tunisia, given the gravity of the situation and the high number of GBV reports, hotline calls increased 7 times compared to the year before. Several measures has been set up. The hotline for women victims of violence became 24/7. Apart from teleconsultation, the medical sector put on a hotline for psychological assistance, and we received approximately 100,000 calls. The listeners benefit from crisis coaching and learn how we can identify situations that need immediate intervention. We did an awareness spot that promote the hotline and encourage women victims of violence to press charges against the perpetrator. We have established a shelter responding to the norms of COVID-19 with a capacity of 10 women and their children, which stayed during 14 days before sending them to the various shelters in the different regions. But the most interesting mechanism is the organization weekly, a coordination and follow-up meetings between women ministry, governmental and non-governmental partners, which helped reduce the shortcomings observed and ensure better coordination on a regional level. Finally, we publish advice for parents on how to better manage disorders in their children in connection with COVID-19. Concerning the best way to guarantee the effective participation of women is to use the Women Commission elected in the municipalities as a starting point. I remind you that in Tunisia, in 2018, there were municipal elections with a percentage of women elected at almost 50%. A planning process will start in consultation with women in the region to identify their needs and the appropriate means to improve their quality of life. For these women, a capacity building program must be done in parallel. As you know, participation improves skills and women empowered have better participation. These women's commission in the municipality will work closely with civil society and with governmental agencies. As a doctor working in a structure that defends the women's rights, I will make sure to include sexual and reproductive rights, including the fight against GBV, on the agenda. The participatory approach must also be integrated within families and in educational structures to prepare children from an early age to get them actively involved and gradually learn to participate in decision-making at the level of the affairs that concern them. Thank you.
Thank you so much. Thank you so much, Dr. Winish, for sharing what is happening also, on the ground, and the center that you are leading with all those calls. And we have this kind of information reported from all around the world, an increase in call and the request for support from women. So thank you so much for your contribution. And I would like to thank also Ms. Paula Thompson and Minister Karina Gould for phrasing so well the need to have a continuity on the sexual and reproductive health, the sexual and reproductive health services, and the fact that we have to have gender-based violence essential services as an essential component of the response to any pandemic as the COVID-19 one. And in the case of UNFPA, for example, the analysis that were done, we only have 51 countries so far having declared essential services package as an essential component of gender-based violence response. So there is much more to do in that area. I would like to really thank you, and just to remind, acknowledge first that we have on YouTube about 400 people who are following live this conversation. Thank you so much for joining us live in YouTube. Kudos to you. And we do hope that you appreciate the conversation, and please feel free to send some questions, and hopefully we'll have few time. I would like also to remind everybody that we are using hashtag what is next for number 4 women. Hashtag what is next for women. Thank you so much for amplifying the conversation of today. So this is the last, we are going to move into the second segment of the conversation, which is looking a little bit more at the gender equality and rights, and go a little bit deeper into that conversation with few panelists. I think that we have already discussed, and it has already been highlighted, the gender impact on health outcomes and of women's risk and vulnerability, shaped by multiple intersecting factors of inequalities. And no one is better placed to speak of this issue than the UN Secretary General Special Representative on Sexual Violence in Conflict, Ms. Pramila Patten. We can also attest that there are many worries and anxieties related to COVID-19 that have put a lot of pressure on adults, but young people also are feeling that pressure, and particularly girls, adolescent girls, who are particularly affected, and it was mentioned, child marriage, FGM, and all. Young people always remind us, nothing for us without us. So today, Jean-Philippe Lawson is going to bring his voice, and we will have the Center for Women's Global Leadership who combined with our resources and accelerated action to eliminate GBV by 2030. The center is the originator of the 16 Days campaign against gender-based violence. So Ms. Krishanti Dharmara, Executive Director, will speak about particularly the health workers and violence in the workplace. So without any ado, let me turn over to Special Representative Patten. Please, you have the floor. Thank you.
Thank you, Nafisa, and good morning, good afternoon to all of you. As previous speakers have mentioned, indeed, COVID-19 is causing an unprecedented crisis that is disrupting lives, economies, health, and societies. COVID-19 does not discriminate, but its impact does. Evidence is already showing how the impacts of COVID-19 are different for women and men. and how they are exacerbating existing gender inequalities and posing an additional burden for women and girls. COVID-19 has altered perceptions of safety and security for millions of people in social isolation, particularly for women and girls. As communities around the world are forced to stay at home, women and girls are particularly at a heightened risk of domestic violence, child abuse, and other forms of gender-based violence. GBV does not begin with disasters like COVID-19, but the chaos and instability it causes is providing an enabling environment that may exacerbate or spark diverse forms of violence, including sexual violence. GBV is a hidden consequence of the COVID-19 pandemic, which is further exacerbated in the context of conflict, violent extremism, terrorism, displacement, and migration. GBV takes many forms and happens everywhere, in homes, in detention facilities, and camps for internally displaced persons and refugees. It happens at any time, such as while performing daily activities, such as collecting water and fuel. In a number of conflict countries, my senior women protection advisors have already signaled how the increase in the need to collect water and fuel, which is a role performed by women and adolescent girls, the increase in the number of trips made and the distance traveled is putting women and girls at increased risk of sexual violence. Similarly, they have signaled the heightened risk of forced and early marriage faced by adolescent girls as families seek to mitigate dire economic consequences of COVID-19. We have seen how in Somalia, girls forced to stay at home due to COVID-19 are undergoing FGM as cutters resort to door-to-door FGM. With international, regional, and national conflict resolution efforts and peace processes stalled as the world responds to COVID-19, an escalation of violence in some conflict settings has also been noted, with sexual violence used as a tactic of war and terror by different armed and terrorist groups who see a window of opportunities to strike while the attention of governments is turned towards the pandemic. COVID-19 is already having negative impacts on the reporting of cases of sexual violence, on service provision to survivors, and on justice and accountability. Already a dramatically underreported crime, CRSV now risks being further obscured by the pandemic due to the imposition of quarantines, curfews, and other restrictions on movement, limited access to first responders, fear of contracting COVID-19. Restrictions on the movement of police and security forces is creating a rule of law vacuum in remote communities and is increasing the prevalence of GBV. A direct impact of the pandemic is an increased burden on health services as resources are being prioritized for the COVID-19 response. The contraction of routine health services means barriers to service provision for victims of GBV, including reduced supply of essential services and access to sexual and reproductive health. COVID-19 is also posing serious challenges to the effective functioning of justice systems. With the lockdown on judges, prosecutors, and lawyers, judicial activity is paralyzed with important trials stalled. There are also limitations on the availability and capacity to receive and process reports on incidents of GBV by law enforcement and judicial authorities. And while combating impunity for GBV is a fundamental aspect of deterring and preventing such crimes, the lack of access to justice is opening doors to a context favorable to impunity. As we strive to ensure that gains made are not rolled back or reversed, there are important lessons to be drawn from previous public health emergencies, including the 2013-2015 Ebola outbreak in West Africa, where similar increases in GBV was observed. During Ebola, public health infrastructure also came to a grinding halt. In a desperate attempt to control the virus, governments also employed many of the current social distancing strategies, school closures, curfews, and quarantines. What happened as Ebola spread throughout West Africa was that while resources were prioritized by governments for the Ebola response, heavily burdened relief efforts failed to account for the needs of women and girls, with GBV largely ignored in response and recovery planning. Unfortunately, many governments and organizations waited until Ebola was under control before addressing these needs, and by then it was too late. As we design our policy and program responses to prevent and respond to GBV, we must draw from those valuable lessons learned. Unequal gender relations and patriarchal norms are aggravated with the potential to further magnify and modify risk and protective factors. GBV is one of the fundamental social, political, and economic means by which the subordinate position of women with respect to men and their stereotype roles are perpetrated. This violence is a critical obstacle to achieving substantive equality between women and men, as well as to women's enjoyment of human rights and fundamental freedom. COVID-19 also raises particular concerns for the most marginalized and vulnerable in society. Marginalization creates vulnerability. Inequality already affects the enjoyment of human rights by certain marginalized communities. The pandemic is revealing underlying structural inequalities that are causing certain groups to be disproportionately affected. Women are not a homogeneous group. Because women experience varying and intersecting forms of discrimination, which have an aggravating negative impact, GBV affects some women to different degrees and in different ways. The discrimination experienced by women is multidimensional and is exacerbated by other forms of discrimination based on factors such as age, ethnic origin, disability, poverty levels, sexual orientation and gender identity, migrant status, marital and family status, literacy, and other grounds. Women who are members of minority, ethnic, or indigenous groups, refugees, internally displaced, or stateless often experience a disproportionate degree of discrimination. Therefore, as we move forward, it is imperative that the national response plan on COVID-19 be grounded in a strong knowledge of gender dynamics, gender relations, with sex and disaggregated data that takes into account the differing experiences of all vulnerable groups, the gendered roles, needs, responsibilities, and dynamics. An intersectional approach which includes a consideration of where gender intersects with other inequalities, oppression, is necessary when we adopt and design and develop appropriate context-specific responses. We need a complete picture of intersecting types of discrimination to understand and effectively address and prevent the spectrum of GBV. We must all advocate at all times for an intersectional, inclusive, gender responsive, and feminist-informed pandemic response, where every COVID-19 response plan, every recovery package, and budgeting of resources addresses the gender impact of this pandemic. Concretely, governments need to ensure that gender equality and women's empowerment are both integrated as a cross-cutting commitment in prevention, response, and recovery, and made an integral factor in effective COVID-19 mitigation strategies and actions. Women are critical enablers in such efforts and need to be centrally engaged in driving solutions for COVID-19. Prevention and mitigation initiatives need to be integrated across sectors, and a top-down approach with interventions coordinated and implemented through centralized agencies is not enough. What is required is a bottom-up approach with interventions emerging from within communities that they will most affect. And in that connection, community gatekeepers, including religious, traditional, women and youth leaders, should play a key role in both virus and GBV mitigation initiatives. They can also serve, of course, as early warning and alert groups within the community. Last but not least, data collection and analysis is the backbone of results-based programming, and it is critical to the effectiveness of targeted service delivery, advocacy, and policy development. Therefore, comprehensive data on the gendered impact of COVID must be collected. In conclusion, the impact of COVID-19 will be wide-scale, long-standing, and likely generational. How we respond today presents a unique opportunity to course-correct and to tackle the root causes of discrimination and widespread inequalities that have been harmful for so many women and girls, made more vulnerable both to the disease and to the economic and social impact of the response. The coronavirus pandemic is an opportunity for the international community to act in solidarity and turn this crisis into an impetus to achieve the SDGs, to address structural inequalities and deficits that have consistently held women back. And we need to reimagine and transform societies. Response and recovery planning must ensure that those most impacted by COVID-19 are not forgotten and are not left behind. Thank you.
Nafi, the mic.
Yeah.
Thank you, Representative, Special Representative Patton, for bringing this vision and particularly the bottom-up approach that is needed for this. Jean-Philippe Lawson, please, over to you, representative of our young men leadership.
Thank you very much for the opportunity. I want to thank UNFPA. I'm also going to say it's a pleasure for me to join this platform of exceptional women leaders in the world, especially Dr. Kanem of UNFPA. I also want to say a special thank you to UNFPA Ghana representative, Mr. Nio Jolatwe, and the entire country office for championing youth issues and also for promoting the gender agenda in Ghana. So now to my main submission, I'm going to talk about the challenges and concerns facing young people in the context of gender-based violence. And I want to talk about them in these broad ways. 1, the wrong shame narrative. 2, the reluctance of authorities to act. 3, the time of return to school. And also 4, the straining of health systems. Talking about the wrong shame narrative, in cases of gender-based violence, we've seen women and girls who have mostly been the victims being the ones who are shamed to the neglect of those who really perpetrate this crimes against women. And this is something that must be changed, and it's a big concern. Another concern is the reluctance of authorities to act. More often than not, in cases of gender-based violence, we've seen women and girls not having justice being served to them in a swift manner or to a very conclusive level. And in many parts of sub-Saharan Africa, even where I come from, you find these issues making society to push for other ways to seek justice. So in recent time, we saw the rape and murder of a girl who went to the church just to study, and that is UWA, and it led to the protest about justice for UWA in Nigeria. This is a big issue because of the reluctance of authorities to act. It's a big concern, and it leads me to the next concern, the time of return to school. With the onset of the COVID-19 pandemic, we've seen many schools closing. It means for many girls and even boys, they won't have access to the adolescent health clubs where they could have access to peer educators and people who give them guidance and counseling as to how to protect themselves from sexual and gender-based violence. This is a big issue, and it's also exposing the girls to female genital mutilation and also sexual assault because they are more at home and not at school. And it's also leading to a bigger problem, the issue of forced and child marriages. With the time of going to school not being currently sure, it leads parents or some people to push girls into marriages. This is a big concern and a big issue in the context of gender-based violence, which we need to look at. Also is the straining of health systems. We realize that many governments, even in our case here, has concentrated more of the effort on the response towards the COVID-19 pandemic. And it's leading in a way to the neglect of the essential issues of providing youth-friendly services and also gender-based violence. And I've seen in the case of Ghana, UNFPA Ghana, for instance, moving swiftly to ensure that gender-based violence is not removed because it's a big issue on its own. And what I saw will lead me to the solutions I'm going to mention. In light of these challenges and concerns, I think some of the solutions that can be used to address this in the light of the pandemic is for us to shift the shame from victims to perpetrators. We must make sure we engage men and boys rightly because they are mostly the ones who commit these crimes against girls. And it's for us to make them know that it's not just indiscipline, but it is criminal on their part if they rape girls and think they can go free with it. These are big issues. We must teach men and boys to respect girls so that even when they go in context of conflict, they wouldn't use sexual violence as a weapon of war. This is important. The next solution I think we should look at is expanding mass education on ending gender-based violence on TV, on radio, over text messaging and social media. We must reach people everywhere. I've seen this to be practical because in the case of UNFPA Ghana, with the onset of the pandemic, we saw a large coalition of civil society actors, traditional and religious and faith-based leaders, activists, and also celebrities or influencers sending out messages across TV, via text messages, and social media for us to stop gender-based violence. This helps society to build a strong opinion against gender-based violence, and it will help us to solve it. Another thing for us to do is to invest financial resources for the fight against gender-based violence. We must make sure we put our money where our mouth is. We must not allow the systems to concentrate only on the pandemic, because if we concentrate only on the COVID-19 pandemic, another pandemic will be increasing, and that's gender-based violence. We must not neglect it in any way. So I think I'll just end my submission in this way by recapping. I think the solution is for us to shift the shame from victims to perpetrators. We must also expand mass education on ending gender-based violence on radio, on TV, text messaging, social media, everywhere we can reach people, so that we build a strong public opinion against gender-based violence. And finally, it's for us to invest financial resources and even human resources, because mostly we've seen midwives, nurses, and people who even cater for young people's needs in youth-friendly service centers being on the front line of the pandemic. And these are issues affecting young people, and these are sure solutions I think we can use to make sure we build a better future for women as we move on. Thank you very much.
Thank you. Thank you so much, Mr. Lawson. What a great passion. I mean, I was like, ooh, you know, he even took out the hat, you know, just to show the passion here. We need that energy. And thank you so much for joining us today and sharing. Ms. Krishanti Dharmara, Center for Women's Global Leadership, the floor is yours.
Thank you very much. I am honored to be with all of you. My country of choice and my country of residence right now is the United States of America. As you know, we are currently facing two viruses that are killing us. COVID-19, you have seen the numbers, and racism. So my remarks are in this context. While I speak to global pandemic, my remarks come from where I am right now, while the people around me are in crisis. I also want to begin by saying that imagine two bookends, and my conversation is going to be between these two bookends. One is that master's tools does not dismantle the master's own. Audre Lorde. The second is that no problem can be solved from the same consciousness that created it, Einstein. Therefore, addressing a pandemic requires one to seek solutions outside the box, beyond borders, and beyond the systems that we uphold as solid, because the systems in itself has failed us. So how do we now engage in a world that will really shift? Because we cannot go back to business as usual. We have to reimagine what we want and figure out how to get it. There's a staggering number of deaths caused by the virus. I mean, at this given time, I'm speaking about the coronavirus, and there are more men dying compared to women. However, a disproportionate amount of the burden of the virus is carried by women. As we heard from Dr. Khanam, women make up over 70% of the healthcare workers. They are the caretakers, 48% of the paid workforce. As you already know, this pandemic, women are facing violence in the home at an unprecedented level. We have to recognize that violence is a manifestation of gender-based discrimination, systemic discrimination, inequality that is set up by the systems that we are working within. So if we are to really eradicate gender-based violence, we have to address gender-based discrimination, exclusion, devaluation of women and girls. 1.3 billion of us women face violence across the world, and 66,000 of women are violently killed every year. These are only the reported cases. Just like the coronavirus, gender-based violence transcends religion, culture, class, all other identities, spans across geographies, disrupts social, economic, political systems, and destroys communities and nations. Therefore, we must also recognize and address gender-based violence as a pandemic. We have begun to talk about it, and it is time for us to act on it. Gender-based violence destroys women's health, our mental health, our physical health, our sexual health, and it impacts the health of actually communities and a nation. So when we think about the current pandemic, it has actually provided us an opportunity to go beyond business as usual, okay? Because the world as we know it will never, ever be the same. Women continue to govern and lead in ways that uphold humanity, and we have witnessed it during this pandemic. New Zealand, we need to recognize, is a win right now. We have to recognize feminist leadership that is outside the box. And feminist leadership includes men and women. And feminist leadership means that we recognize agency, that is the right to self-determination. We recognize inclusion and intersectionality, recognizing that we are not monolithic and there are people in the margins, and any analysis and solutions have to come from those whose humanity is threatened. Okay? And it recognizes solidarity. And this is incredibly important. And I am honored that we are partnering with UNFPA on this work. So when we think about our work, we have to first recognize and demand and hold governments accountable to ensuring that gender parity in leadership and addressing in leadership is essential. Feminist leadership is essential. This is not when things are good, we will think about women. And if we are not there, humanity is threatened. We have to also recognize that gender-based violence is a pandemic. We have to recognize that master's tools will not dismantle the master's home. So therefore, women must be in leadership. And New Zealand is an example. Establishing well-being as an indicator of progress over profit is necessary. We have to really think about what GDP means these days, right? We have to recognize that sustainability of the planet is the best security we need compared to militarization, occupation, and extraction. We can build back a better future, right? There are a couple of things that we have to include. We have to recognize women's unpaid care work. It has to be recognized, reduced, and redistributed. In order for women to be equal, they have to be recognized as contributing to the economy. Social protection is fundamental at a time like this, right? And women's equal participation at all levels, public and private, at home, community, and the government, and at international levels matter. We believe that a world without violence is possible, and Black lives matter. Thank you.
Thank you. Thank you so much, Dr. Damara, for this insight and for bringing, of course, the current situation here in the United States and around the world. That reinforces, of course, all that the need to apply a right-based approach and the intersectionality analysis to everything that we are doing. So thank you so much. I would like to thank Special Representative Patten and Mr. Lawson, strong passion and energy and your insights. This is a perfect transition to our last segment about building back. And I think that you have already started to raise several points and several solutions that need to happen and how we can reimagine our future. I would like to just acknowledge again the YouTube live audience. Thank you so much for joining. And we even had a +1 from Canada. We saw the young Gould, baby Gould, who was looking at us also. It's important to have everybody in this conversation and to start very early the conversation. So hashtag what is next for women, for us a number for women. Please don't forget to use some of these inspiring words that we are hearing today in your social media coverage. So the last one is building back, strengthening prevention, protection, response to gender-based violence. And of course, the best person to talk about that is a minister who is in charge of gender and children. And Minister Manti Tarawali is going to bring us a rich experience for a country that is not only facing the coronavirus, but also faced a few years ago Ebola outbreak. And of course, is facing the other pandemic, which is the GBV pandemic. So we want to hear and learn more about the Sierra Leone response. It's my really great pleasure, Minister Tarawali, to give you the floor. Over to you. You can unmute.
Thank you, UNFPA, for inviting me to participate today. I'm excited and immensely grateful to be here and look forward to the outcomes from these deliberate meetings. With the foresight afforded the government of the Republic of Sierra Leone from the Ebola outbreak, which included disaggregated data that showed 18,000 plus teenage girls became pregnant during the Ebola outbreak, and that also more women, 57%, than men, 43%, contracted Ebola, and more women than men died. Those lessons that we learned, our government understood that our COVID-19 preparedness and response needed to be gender responsive right from the start. Therefore, in developing the COVID-19 preparedness plan, which later turned into the response plan, our government, through my ministry, the Ministry of Gender and Children's Affairs, developed a COVID-19 response gender mainstreaming framework. The framework speaks to 6 objectives and recognizes and defines sexual and reproductive health services, as well as prevention and response to gender-based violence as non-COVID-19 services, but core essential services, which must continue to be provided within the framework of COVID-19 response. I want to take this opportunity to thank UNFPA Sierra Leone, UN Women Sierra Leone, Irish Aid, DFID, and Plan International for the tremendous support they gave to my ministry in rolling out the framework. I also seconded a senior gender expert to the national COVID-19 response. The positioning of a senior expert at the national COVID response strategic team meant we were able to mainstream gender across all the response pillars. as well as monitor the effects of gender mainstreaming at district level. For example, where there were no separate toilets or specific bathrooms or shower rooms for women in isolation and quarantine centers across the country, these facilities have now been made available. In addition to providing technical inputs to the national response, our gender expert has been able to raise awareness on key issues, such as to continue ensuring reproductive, maternal, child, and adolescent health services in all government health facilities across the country during COVID-19. Specific gender messages on COVID-19 prevention and response have been developed by my ministry in partnership with our development partners. And these messages have been made available to women and girls, men and boys in formats that they are able to benefit from. Likewise, confidence building between the communities and health services have been strengthened through community outreach and education on safety and prevention measures, with emphasis on the appropriate use of face masks, frequent hand washing, and social distancing. Also, the community awareness raising and education employs communities to not seek healthcare from traditional healers. Our government and our partners have continued to advocate to the traditional healers not to see sick people, but to refer them to health facilities for all symptoms during this COVID-19 pandemic. Accordingly, a positive partnership has emerged between traditional healers and the health system, in which traditional healers have become partners in health as referral points for health services. My ministry has established a 24-hour rape hotline within the context and framework of the COVID-19 response. The hotline has become a lifeline for anyone wanting to reach help quickly for GBV. For example, we received a call at 10 p.m. of a rape of a 10-year-old girl. Within 3 hours, there was an arrest. The hotline receives approximately 430 calls a day, 3,000 calls a week. Additionally, one-stop centers will be established by my ministry in every district referral hospital. The first 5 centers will be launched on the 30th of June. These centers will provide a survivor-centered, comprehensive, quality package of care and treatment for GBV, including legal services, psychosocial care, forensic medical examination and treatment, development of the crime report, and safe homes as and when necessary. With the establishment of the one-stop centers, a new policy will apply. The survivor will no longer need to go to the police station to report SGBV or GBV. Rather, the police will now go to the one-stop center to take the statement from the victim and get the report signed off by the center's paralegal. This will cut out any possible police intimidation and help safeguard victims' records as a duplicate copy of the police records stored at the center to be availed as necessary. Accordingly, enhanced access to justice for victims is therefore envisaged through the one-stop centers. The systematic generation of gender disaggregated data on key areas of the response has also been done. This is supporting targeted response to the gender differential needs of women and girls, men and boys. Much attention in support of healthcare providers is more pronounced now than during the Ebola outbreak. Allowances like tax rebates and rewards to treatment and isolation center workers are now being paid. In fact, just last week, our government has instituted life insurance for all health workers who are the frontline care providers. The male involvement policy for the prevention of gender-based violence that I launched at the very beginning of COVID-19 is being widely implemented within the context of COVID response. And this is expected to add tremendous value to reducing GBV. Thank you.
Thank you so much, Minister. Thank you for all this rich information of a response in Sierra Leone. And particularly, I was particularly interested by the partnership between traditional healers and the health system. So thank you for sharing that. So this is actually a very good transition to the last questions that we are going to have. We have 15 minutes for each of us to give one essential element to ensure that we are reimagining our world without gender-based violence. And I will start by you, Minister. In 2 minutes, what is your one essential element? Thank you.
Thank you. I think this is such an important question because the pandemic is an opportunity to hit the reset button. And as you say, reimagine how we can make societies everywhere more resilient and inclusive. And I think particularly on the heels of movements like Me Too and Black Lives Matter, we all have been called upon to conduct a much needed, profound re-examination of deeply rooted systemic inequalities that will allow us to truly have these issues acknowledged and no longer accepted, so that we can begin to be on a path to heal and move forward in a truly inclusive way. Racism, sexism, homophobia, as we have heard, feed into gender-based violence and are deeply rooted and result in grave human rights violations that disproportionately affect the most vulnerable and marginalized populations, especially in times of crisis. I join my voice to call on all of us to reflect deeply on how we can root out racism, sexism, and homophobia within our own institutions and to work intentionally to create flatter, more equitable structures that are based in a human rights-based approach. With COVID-19 exacerbating gender-based violence around the world, it is urgent that we all do what we can to prevent and respond to this epidemic of violence. Our first step can be to recognize gender-based violence services and those responding to abuse and exploitation of children as essential. With the help of civil society, women's organizations, and all levels of government, we must ensure that we have a system that includes responsible and inclusive health, justice, and police services that respond to the needs of survivors and who serve their communities. In terms of health systems, governments need to see sexual and reproductive health and rights as an integral part of the system and necessary for well-being and growth. We must establish safe locations and expand the capacity of shelters and hotlines and find innovative ways to expand our reach to vulnerable populations. We must also end impunity for perpetrators of violence against women and girls and LGBTQ2 persons, making them legally accountable for their actions. Donors and partners must work together to make sure women's rights organizations operating on the front line of community responses are supported and well-funded. Their operations are vital to a comprehensive pandemic response. Inclusive leadership and participation of marginalized communities is needed in this moment of emergency, so that our rebuilding efforts have a lasting impact and an approach that sees women and girls at the center of recovery. I think those are some ways that we can achieve a safer, better, and more equal world. And thank you again for organizing this really important conversation and inviting me to participate.
Thank you so much. Minister Tarawali, your 1 minute for one element. You unmute.
1 minute too. I agree that the COVID-19 pandemic, while it is unprecedented, it offers us the opportunity to build back better. The integrated hotline and the one-stop centers are definitely envisaged as part of building back better and safer, as they will put the dignity and rehabilitation of survivors as a central objective in responding to sexual gender-based violence. The collaboration between community and the health service delivery, as you also mentioned, is emerging within the COVID-19 response. And this is another strong practice and platform to build back better. This is exemplified through the partnership between the healthcare providers and the community leaders, including traditional healers, as part of a health referral system. This will add great value in achieving universal healthcare, including prioritizing reproductive health services. Likewise, the evolving partnership between in-country women clothing manufacturers who are producing PPEs and the health system is a build back better and safer potential, to create obviously economic empowerment for women. Thank you.
Thank you, Minister. Thank you, Ms. Special Representative Patton. 1 minute.
Thank you. Well, for me, a gender responsive health system is one which places a gender perspective at the center of all policies and programs affecting women's health, and also involve women in the planning, implementation, and monitoring of such policies and programs. A health system that promotes women's health throughout their lifespan, ensures universal access for all women to a full range of high quality and affordable healthcare, including sexual and reproductive health services, ensures the removal of all barriers to women's access to health services, education and information, including in the area of sexual and reproductive health, and in particular allocate adequate budgetary, human and administrative resources. That includes interventions aimed at both prevention and treatment of disease and conditions affecting women, pay special attention to the health needs and rights of women belonging to vulnerable and disadvantaged groups, such as migrant women, refugee and internally displaced women, the girl child and older women, indigenous women, women with disabilities, or women living with HIV/AIDS, and is consistent with the human rights of women, including the rights to autonomy, privacy, confidentiality, informed consent, and choice. Thank you.
Thank you. Thank you so much. Then Dr. Winish, you have 1 minute. How do we build back?
I have 2 minutes. Okay. When I saw the whole world united to fight COVID-19, it inspired me because if we compare GBV to a global pandemic that killed thousands of women every year, we can work together on a universal scale. This GBV disease is underpinned by discriminating stereotypes carried by men, women, stakeholders, as well as decision makers. These stereotypes are socially transmissible and explain this resistance of each other despite changes in the laws. Previously, if for COVID-19 we opted for an environmental that respects hygiene measures, we need a social environment that is respectful of human rights and where resources are accessible. Concerning the suspending of transmission for COVID-19, we put social barriers, but with GBV, we must suspend intergenerational transmission to working on psychological trauma due to the violence suffered during childhood. In fact, if we don't treat this psychotrauma, the risk of reproducing violence or even accepting it later is increasing. On another side, faced with the discriminating social stereotypes that form the bedrock of GBV, we can neutralize them by adapted vaccine. This vaccine, which be used from an early age, consists of getting to know yourself, communicating assertively, thinking critically, learning the decision-making process, managing emotions. To develop these capacities, you need what I call a resilience tutor. If it could be you, me, the social worker, the midwife, the worker in the association. This is the time to use this vaccine. We are only in the beginning of the path. Thank you.
Thank you so much. Ms. Damara Shanti, 1 minute, please, or less.
Thank you very much. When we make women healthy, we make a country healthy. And when countries are healthy, the world is healthy. So it is essential that we pay attention to the well-being of women. Right? In order to do that, we need to recognize and have the human rights framework working for us because it transcends borders, it has a universal set of standards, and it is inextricably linked to other aspects. So if we are looking at gender-based violence, we have to bring in economic, social, cultural, civil, and political rights into the framing. We have to recognize that the existing systems that I talked about doesn't work. So our responses have to be outside these existing systems. I want to bring up 3 things that we are working on. We hope you will join. We have to shift the discourse on how gender-based violence is reported in the media. We have a journalism initiative for that on gender-based violence. We have to recognize and galvanize globally to take all the work we are doing during the year and amplify it during 16 days. So join us with this campaign to end gender violence, very specifically informal sector workers. And the third I wanted to bring is around bringing the voices and ensuring and amplifying the voices of women of the global South and from marginalized communities of the global North. And Feminist Alliance for Rights is doing this work, and I think we need to support them.
We've heard some great examples, and I hope we will collect and share them. What's going on in Sierra Leone is indeed something that we need to replicate. For Impact 40, which is our platform to analyze data related to the 3 zeros of UNFPA, this gender lens has to be applied to the COVID pandemic in every sphere, and the behavioral links and the need for quality mental health and social work support. These are things that are going to cost money, and we're going to mobilize with help of people like Karina Gould and the example of the feminist government of Canada going forward. I think data will really be key, and we have an advantage there. This is not just for scientists and physicians. This is data in the hands of communities who want to make a difference. So to accelerate this action and to achieve zero gender-based violence, including harmful practices by 2030, we've partnered with the Center for Women's Global Leadership. You heard Prashanti as a partner here today. And we are reimagining together the center's 16 Days campaign. And as they shift the focus from awareness to accountability, we're going to march with them to pursue that aim in the 16 to 365 days of GBV disruptors. And we will use this opportunity to amplify UNFPA programs for data and evidence. I will close with a quote from Audre Lorde that I also love. Life is very short, and what we have to do must be done in the now. Thank you so much to everyone who's participated, and we look forward to continuing the What's Next conversations. Thank you so much. Back to you, Nafi.
Thank you so much for to all the panelists, and thank you so much, Dr. Kanem, for this last word and for the GBV disruptors, that we are going to really to disrupt this tendency and this trend of gender-based violence. And we will go, at the root also within the home and everywhere. We will get up every morning with determination to act for ensuring that our women, our sisters, our daughters, our girls are safe, empowered, equality treated and respected, and that they will have access to family goods, to economic goods at the same level as men. And so I would like to thank you for your brilliant ideas today, and call you for the next global conversation with the Executive Director of UNFPA on June 25th about the socioeconomic consequences of COVID that we are only starting to see. And we know that over the next 5 years, we will still live with those long-term socioeconomic consequences. So keep safe, keep strong, and let's disrupt this gender-based violence and reach the zero GBV by 2030. Thank you so much for your attention today. Hashtag what is next for women.
Thank you. Thanks, everyone. All the best. Bye.